Your sleep has changed, and you're wondering if it's just getting older. Here's what most people don't realize. Those sleep problems you're experiencing might not be normal aging at all. They could be warning signs of something serious that needs immediate attention. I'm going to share something with you today that could literally save your life. Because when it comes to sleep disorders in older adults, the line between normal aging and dangerous medical conditions is thinner than you think. And knowing the difference could prevent a stroke, heart attack, or cognitive decline. Let me ask you something. Do you wake up gasping for air at night? Does your partner complain about your snoring? Are you exhausted no matter how long you stay in bed? These aren't just annoying problems. They're your body's way of screaming for help. Here's the truth about sleep and aging that nobody talks about. Yes, your sleep patterns change as you get older. That's completely normal. But severe sleep disruption, chronic insomnia, or dangerous breathing problems during sleep are never normal at any age. Let's start with what actually happens to your sleep as you age. Your circadian rhythm shifts earlier. You might feel tired at 8 p.m. instead of 10 p.m. You might wake up at 5 a.m. instead of 7 a.m. That's natural. Your deep sleep decreases slightly. You spend less time in REM sleep. These changes are expected. But here's where things get dangerous. Many older adults accept terrible sleep as inevitable. They suffer through years of exhaustion, thinking it's just part of getting old. Meanwhile, they're developing serious health problems that could have been prevented. Sleep apnea is the silent killer that affects millions of older adults. This condition causes you to stop breathing repeatedly throughout the night. Your oxygen levels drop. Your brain partially wakes up to restart breathing. This happens dozens or even hundreds of times per night. You don't remember it happening, but your body is under constant stress. The consequences are devastating. Sleep apnea increases your risk of high blood pressure by 300%. It doubles your risk of stroke. It triples your risk of heart disease. It accelerates cognitive decline and increases dementia risk. Yet most people with sleep apnea don't even know they have it. How do you know if you have sleep apnea? The warning signs are clear. Loud snoring that disturbs your partner. Gasping or choking during sleep. Waking up with a dry mouth or sore throat. Morning headaches that won't go away. Extreme daytime fatigue despite spending 8 hours in bed. Difficulty concentrating or memory problems. Mood changes or irritability. If you have 3 or more of these symptoms, you need to see a doctor immediately. Not next month. Not when you get around to it. Now. Because every night you spend with untreated sleep apnea damages your cardiovascular system and brain. Insomnia is another major problem in older adults. But not all insomnia is the same. Acute insomnia lasts a few days or weeks. It's usually triggered by stress, illness, or life changes. This type often resolves on its own or with short-term treatment. Chronic insomnia is different. It occurs at least 3 nights per week for 3 months or longer. This isn't normal aging. This is a medical condition that requires professional help. Chronic insomnia increases your risk of depression, anxiety, diabetes, and heart disease. Many older adults develop insomnia because of medications they're taking. Blood pressure medications, antidepressants, corticosteroids, and many other common drugs can disrupt sleep. If your sleep problems started after beginning a new medication, tell your doctor immediately. There might be alternatives that won't affect your sleep. Restless leg syndrome becomes more common with age. This neurological condition causes uncomfortable sensations in your legs, especially at night. You feel an irresistible urge to move them. It makes falling asleep nearly impossible. Many people suffer for years before getting diagnosed and treated. The good news is that restless leg syndrome responds well to treatment. Iron supplements help some people. Certain medications can provide relief. Lifestyle changes make a difference. But you need a proper diagnosis first. Don't just accept this as normal aging. Circadian rhythm disorders can develop as you age. Your internal clock gets disrupted. You might fall asleep very early and wake up extremely early. Or you might struggle to fall asleep until very late. These patterns interfere with your daily life and social activities. Advanced sleep phase syndrome is common in older adults. You feel exhausted by 7 or 8 p.m. You wake up at 3 or 4 a.m. and can't fall back asleep. This isn't just being an early bird. It's a disorder that can be treated with light therapy, melatonin, and behavioral strategies. REM sleep behavior disorder is particularly concerning in older adults. During normal REM sleep, your muscles are paralyzed. You dream but don't act out those dreams. With REM sleep behavior disorder, this paralysis doesn't occur. You physically act out your dreams. You might punch, kick, or jump out of bed. This disorder is dangerous for obvious reasons. You can injure yourself or your partner. But it's also a warning sign. REM sleep behavior disorder often appears years before Parkinson's disease or other neurodegenerative conditions develop. Early diagnosis and treatment are crucial. Depression and sleep problems create a vicious cycle in older adults. Depression disrupts sleep. Poor sleep worsens depression. Many older adults don't recognize they're depressed. They focus on physical symptoms like fatigue and sleep problems. They never address the underlying depression. If you're experiencing sleep problems along with persistent sadness, loss of interest in activities, appetite changes, or thoughts of death, you need mental health evaluation. Treating the depression often resolves the sleep problems. Ignoring it makes everything worse. Medications and substances affect sleep more as you age. Your body processes drugs differently. That glass of wine with dinner might have disrupted your sleep for years without you realizing it. Caffeine consumed even 6 hours before bed can interfere with sleep in older adults. Many over-the-counter sleep aids are dangerous for older adults. Diphenhydramine, found in many sleep medications, increases fall risk, causes confusion, and worsens memory problems. Never take these without consulting your doctor. The risks often outweigh any potential benefits. Pain is a major sleep disruptor in older adults. Arthritis, back pain, neuropathy, and other chronic pain conditions make sleep difficult. You can't get comfortable. You wake up every time you move. The pain never gives you a break. But here's what you need to understand. Accepting pain as inevitable is a mistake. Modern pain management offers many options. Physical therapy, medications, injections, and other treatments can reduce pain and improve sleep. You don't have to suffer. So when should you see a doctor about sleep problems? The answer is clearer than you might think. See a doctor immediately if you experience gasping or choking during sleep. If your partner reports that you stop breathing. If you have severe daytime sleepiness that interferes with activities. If you fall asleep while driving or during conversations. See a doctor soon if you can't fall asleep or stay asleep at least 3 nights per week for more than a month. If you need sleeping pills regularly to sleep. If you have uncomfortable sensations in your legs at night. If you act out your dreams physically. If sleep problems are affecting your mood, memory, or daily functioning. Don't wait if you're experiencing morning headaches, high blood pressure that's hard to control, or worsening memory problems along with sleep issues. These combinations suggest serious underlying conditions that need immediate evaluation. What happens when you see a doctor for sleep problems? They'll start with a detailed sleep history. They'll ask about your sleep schedule, bedroom environment, medications, and symptoms. They'll want to know about snoring, leg movements, and daytime functioning. Your doctor might recommend a sleep study. This test monitors your breathing, oxygen levels, heart rate, and body movements during sleep. It's the gold standard for diagnosing sleep apnea and many other sleep disorders. Modern sleep studies can often be done at home with portable equipment. Treatment options vary depending on your diagnosis. Sleep apnea is typically treated with CPAP therapy. This device keeps your airway open during sleep. It takes some adjustment, but it's life-changing for most people. Alternative treatments include oral appliances, positional therapy, or surgery in some cases. Insomnia treatment often starts with cognitive behavioral therapy for insomnia, or CBTI. This approach addresses the thoughts and behaviors that perpetuate insomnia. It's more effective than sleeping pills for long-term results. It has no side effects. It works for most people who commit to the program. Medications might be necessary for some sleep disorders, but they should be used carefully in older adults. Your doctor will choose medications with the lowest risk of side effects. They'll start with low doses. They'll monitor you closely for problems. Lifestyle changes make a huge difference for many sleep disorders. Maintaining a consistent sleep schedule helps regulate your circadian rhythm. Creating a cool, dark, quiet bedroom environment improves sleep quality. Limiting screen time before bed reduces sleep disruption. Regular exercise improves sleep, but timing matters. Morning or afternoon exercise is ideal. Late evening exercise can be stimulating. Even gentle activities like walking or stretching help if done consistently. Your diet affects your sleep more than you realize. Large meals close to bedtime disrupt sleep. Spicy or acidic foods can cause reflux. Limiting fluids in the evening reduces nighttime bathroom trips. But don't go to bed hungry either. A light snack can help. The bottom line is simple. Sleep problems in older adults are common but not normal. They're not something you just have to live with. They're medical conditions that can and should be treated. Ignoring them puts your health, safety, and quality of life at risk. Your sleep matters just as much at 70 as it did at 30. Maybe more, because poor sleep accelerates aging and disease. You deserve restful, restorative sleep. You deserve to wake up feeling refreshed. You deserve to have the energy to enjoy your life. Don't accept exhaustion as your new normal. Don't let anyone tell you that terrible sleep is just part of getting old. It's not. And you don't have to suffer through it. Help is available. Effective treatments exist. You just need to take that first step and talk to your doctor. Your future self will thank you for taking action today. Better sleep means better health, better mood, better memory, and better quality of life. That's worth fighting for at any age.